and say met to talk about our strategy leading toward General Conference. And what we knew was that there would be many moving parts that we needed to care for and tend to. And so listed, you'll see them, and I'll name them briefly to tell you kind of where they came from and what decision was made. So as you know, if a social principles paragraph is opened up, well, I'm going to step back for 1 second. Resolutions expire every 8 years, and so we are responsible for revising and resubmitting them if we want them to remain part of what our church says about different issues. Social principles remain the same unless someone actively changes them, and so we made a decision. Although there's language in the abortion paragraph that we don't particularly like, we made a decision to leave the paragraph alone because we didn't want to be the ones opening it up for any change to happen to it. So the changes to the abortion social principles paragraph and the healthcare social principles paragraph were brought by other people who didn't like the language as it currently stands. The Responsible Parenthood resolution, that petition was brought by United Methodist Women. GBCS worked in partnerships to write that, and it's going to expire. If it did not, we did not submit it for revision. So that went through United Methodist Women. Religious Coalition for Reproductive Choice, that petition was going to expire, and there was also another petition calling for our withdrawal. We'll talk about that in a second. The child, the status of women, were both petitions that were revised by United Methodist Women because they were also going to expire. Healthcare for All in the U.S. and Health and Wholeness were revised petitions and that church and society cared for. And when we say that agencies care for them, understand that these are our boards of directors who do this work. And the last one is a new petition, Global Health and Rights, Eradicating Sexual and Gender-Based Violence. And this one was written by Church and Society in partnership with Global Ministries, based on what we were seeing in conversation and hearing as we worked around maternal and child health at United Methodists around the world. Thank you. So, screen, you notice that this is a summary of what happened. The petitions, I think 7 in all, asking for changes or suggesting changes to the social principles paragraph. There were extraordinary guests from all over the country and the world in that legislative committee, and there was a really good conversation about the abortion paragraph in particular and different concerns that people had. And ultimately, what came down to the end of those petitions, and I was working with that subcommittee, was there was concern any of the changes being proposed would have the effect of limiting access to abortion for women and girls. I would say that one person who was Kansas talked about her concern that there are places for women who are experienced physical assault, or even a woman who has a child, pregnancy that's not sustainable, that there are not places for the woman or girl to terminate pregnancy because of what's happened with state laws. And then there was a delegate from West Congo who passionately about the shame that is brought upon women and girls and their families, particularly their husbands, were taken into the forest raped by soldiers. And so he felt like it should be an option. And the church should support a woman or girl if she needs to terminate her in that pregnancy. The Philippines and the Congo spoke eloquently to support family planning, reproductive health care, and health care for people living in poverty. At one point, as the Health Care for All in the United States resolution petition was on the floor of the whole plenary. And a lot of people saying that the United Methodist Church should not weigh into political issues, and really looking at this as some of the health care work that President Obama has done. And a delegate from Nigeria stood up and said, really, my brothers and sisters, I hope that you'll consider people who are poor as you take this. But he was not concerned that this petition was related to people in the United States. He was concerned that we as the church speak up for people living in poverty and that everyone should have access to health care. One of our colleagues from the Philippines spoke about the number of women who do not have access to contraception. It just become legal in the Philippines. Contraception has just become legal in the past few years, and there are communities where women are having 15 to 20 children, but they cannot control when they have sex with their husbands, and they do not have any ability to space their time for pregnancies. And so it takes a real toll, and this delegate from the Philippines spoke to that very passionately. Tricia, go back one, please. Sorry, thanks. The Global Health and Rights Petition, Eradicating Sexual and Gender-Based Violence resolution passed, and this passed in the subcommittee, Church and Society 2, by a vote of 62 to 4. It was stood that women and girls are experiencing all kinds of violence, from child marriage to rape as a weapon of war. That there are too many things impacting women and girls where they don't have control over their own humanity, or their own spirituality, and often ending up pregnant with the ability to then pursue what it is that God calls them to be. And so there was understanding that we need to make sure that we are doing all kinds of things to prevent these pregnancies, engaging men as allies, from encouraging men to think about masculinity in a way that's not about power or domination over women, that we as a church need to preach and teach women in Scripture so that we are teaching sacred words and reminding everyone that women are made in the image of God and therefore not disposable. But also in that petition, it calls us as a church to advocate for full and legal access to medically safe reproductive health care services. This was something that, and I don't know the final vote, but it was on, but it passed through on the floor of the plenary. So this is language that will be in the social principles for the next, local resolutions for the 8 years. And as I say this on the slide, you'll know that, and we say this, right, and this is quoted from the petition, now resolution, that violence against women undermines sexual and reproductive health, contributing to unwanted pregnancies, unsafe abortions, fistulas, sexually transmitted infections, and HIV, and their reoccurrence. And these are things that, if you haven't talked about them intimately, we will be doing a lot of education and webinars about these in the future. I was with things I'm mindful of is that, and here at Church and Society, I have the ability to be in conversation with a lot of people whom I wouldn't meet if I weren't in this job. I didn't have this job. And one of the people I've had the pleasure of spending time with is a retired OB-GYN from Asheville, North Carolina, and very committed United Methodist. He talked about his involvement as a medical missionary with Doctors Without Borders in the South Congo, and he said they're midwives who are delivering babies. He said, but when I'm there, my job is to deconstruct the baby that's been stuck in a girl's birth canal because she is not old enough, her birth canal is not developed, and she's been unable to deliver the baby. And never in my life, never in my training would I've ever thought that my job would be to deconstruct a baby. And when you hear those stories, we begin to understand why it is that access to reproductive health care is important. How do we keep girls from having to go through that kind of trauma? And developing a fistula and being excluded from their communities. There are all kinds of things that happen as a result of this. And so this is one of the things that we really feel like needs to be part of our conversation as we explore what it means to be a church advocating for women and girls and health care. And I mentioned the health care for all people, and that the other part of that I mentioned in the beginning is that there was a petition that was recommending the first part of the health care social principles to be deleted. And that first paragraph, it talks about health care as a human right, and it also calls on the United Methodist Church to ensure girls and families have access to reproductive health care for spacing and timing of pregnancy. So in there, that was another place in social principles where we affirm access to comprehensive reproductive health care, including family planning, and that would have been lost had that petition not been defeated.
So, hello all. This is Mollie Vickery with United Methodist Women. The Girl Child and the Status of Women are two of our kind of historic petitions that, in conjunction with our partners, as Susan mentioned, were this time to reflect the current state of women and female children around the world with updated statistics and the challenges they face. Largely had nothing to do with any of the hot-button reproductive health issues. They were more holistic in nature and deal with education and rights and human rights and those sorts of things. And so we feel like they would have passed unanimously, but they were absolutely just left behind. And that was really troubling for us. And so that's kind of one of the questions that we're lifting, and one of the points we're lifting coming from General Conference is that women and girls, in a lot of ways, were left behind. Now, there were some great things passed, but these instances, other things took precedence. Responsible parenthood is one that Susan mentioned that we worked on with many agencies, also a wide variety of pastors, doctors, nurses, all sorts of folks, our regional missionaries who talked with people in their context to make it global and to lift up the sacredness of parenting and the importance for all families to have resources, contraceptives, prenatal and postnatal care, and of course the safe and legal right to abortion. And then we know that when women are able to space and time their pregnancies, the outcome for the entire community is better. So that's one of our important points to raise. Sorry. Okay. And so we feel like this petition spoke to all of those things, and it was a very wide look. But folks who came and spoke against it were looking at it in a very U.S.-centric and privileged context. And so we feel like the Responsible Parenthood didn't really get a full and fair statement from General Conference. Because when you look at it, it's really a much more than abortion. So that's how Responsible Parenthood went down at General Conference. I would also say that it's been noted by some that this somehow signifies a shift in the denomination's stand on abortion, and we want to be real clear that did not change. As Susan lifted up, the paragraph around abortion did not change. And there are other resolutions that do talk about access to reproductive care.
So the last petition that was acted on was the petition calling for United Methodist Women and the General Board of Church and Society to withdraw from the Religious Coalition for Reproductive Choice. And Mollie and I have been in conversation, as well as our general secretaries, about this since this happened. And we lament this decision. And I think that there are lots of ways to look at it in terms of why people called for this. I think that and why General Conference voted for it. I think that I think in past General Conferences, it's been easy to sway delegates who are not from the United States to vote against this because it's very U.S.-centered. Our CRC does not do work in other countries, and so as a church, people outside the United States aren't as familiar with their work. I think the other challenge is that there's not really an understanding of what it means to work in coalition by the church broadly. And so there are many coalitions. There are some petitions actually calling for us as a church to only enter into coalitions if the General Conference agreed to it every 4 years. So we had people in our finance office and pensions office saying, well, wait a minute, there are all kinds of coalitions that we're a part of that help us do our work better. And we think that about RCRC as well, that there are many times where RCRC has been involved in advocating for a particular issue where Mollie and I have had to step back and to say we can't support this because it's not in keeping with the social principles. And so that's something we've understood as a way to be faithful to the church and as a way to be faithful to what General Conference has said and called for us to do. But I know that there's some people who have been frustrated by our membership and did not trust that we were advocating in the way we were supposed to advocate. So it is, and I think that's, to me, one of the great benefits of working in coalition, especially an interfaith coalition, learning the theological differences and where we come to the table in our reproductive health, because it certainly helps us advocate for women and in a similar way. Anything else you wanted to add to that?
I think you did a great job of covering. As Susan said, we've been in pretty distant contact in how we move forward and in our commitment to move forward in this work. Speaking of moving forward, UMW has several events and resources planned that I want to offer up. One is, of course, Mission U. Throughout the summer conference, UMWs will be offering Mission U to the whole church, but resources are also available through our website, so you don't have to go to the event. Some groups choose to use them as ongoing Bible studies or what have you, and this summer, the Bible and Human Sexuality is probably going to be of particular interest. While it does address sexuality, it does it in the full context, including women and their needs. So it's a very good study that I would recommend. So on our website, you can find more information about our maternal health initiative. Also, looking at our national seminar, which occurred this past summer, all of the resources from National Seminar, which included a hefty section on maternal and child health there. And so there are resources there. In the coming year, we'll be adding more to our Mother's Day material that will have different ways to advocate or to plan events that lift up the various challenges that women here and around the world face. And then we also have some advocacy ideas of things you can do to support maternal and child health in your own community. Next slide, please. Our development days, which occur in different locations through fall and then one in early 2017. The identical events that our members can come to, both conference officers, but also any member who wishes to come. There'll be workshops again on maternal health, and of course our plenaries also lift the intersectionality of a variety of issues: race, wealth, maternal and child health, climate justice, and of course, as always, what that means to women and girls. And that resources have ongoing articles about maternal and child health, and along with a variety of issues. Response Magazine, our reading program, and our program book all will have lots about maternal and child health in the coming quadrennium.
Hi, everyone. This is Pauline, and we just finished the general conference, and I believe our work just began, getting ready for the next general conference, because in order for us to protect what we achieved, we need to do more and also get ready, because this is not going to end with this general conference. The next general conference will have just as many petitions as there were, if not more. So we need to build our capacity as women of the United Methodist Church and advocates so that we are able to do more to protect the rights of women and girls. Through the General Conference, through our annual conferences, we know that a lot of you are having your annual conferences, and we hope that you will continue to advocate for women's rights through those annual conferences. Thank you for those who have been reaching out to ask for materials and also for advice in terms of presentations and more as you get ready. So we are building a movement. You know, we know that we have come so far, but as I said, we still have a long way to go. And really, our success will depend on the kind of movement we build, because the women's rights are not just women's rights. They are communities' rights. They are the church's right. So if we just focus on us alone, we're going to miss the goal. We need to build a movement within the church. When our kids are growing up, we need for them to grow up knowing that they're part of this. Men allies, so that they just don't look at women's empowerment and girls' empowerment and family planning as a women issue. This is a community issue. It's a family issue. So we need you to join us in building that movement and help us also know how we can support what you're doing to build the movement in your local church. Please use us as a resource. You know, we are here for you, and we are available to help you prepare presentations and also send you materials and resources. As Susan said before, and as Mollie said, we have tons of resources. You can download them from our website, but we're also very happy to guide you and provide resource materials by shipping them to you or giving you the links to those. One of the resources that we just developed is one called Growing Up, which is a 4-minute video that really talks about the life of a girl from when she gets born and the kind of empowerment that she needs in order to grow up as a person who is created in the image of God. So you can use that video as a conversation starter in your congregation. You can use it during Bible studies. You can use it during women's meetings. You can use it during different events that you're having, annual conferences and others. And we are planning an event, hopefully, maybe around when the kids are going back to school. And we are going to be sending you more details about that so that you and your congregation can participate in that. It is really, I don't know whether you've already seen the video. If you haven't seen it, we had a link. I don't know what happened to it, but we're going to be sending the link to you so that you have it and you can download it from the website. Patricia, next slide, please. Sorry. One of the other things that we've been doing is to train ambassadors so they can be advocates for family planning issues from a district level, from an annual conference level. This is very important because the ambassadors who have been trained have been able to visit the members of Congress on the district level, and they are also able to engage their congregations about these issues. We're going to continue with the training. In the fall, we have 2 trainings, and we'll be announcing them soon which particular annual conferences there will be. And also, we're going to be seeing whether we can invite people from other annual conferences who are close to those annual conferences so that we can collaborate and we are able to, empower, build your capacity to be better advocates. And we're recruiting for more ambassadors. So if you know people in your congregation who would like to be an ambassador, please let us know, because even beside the formal trainings that we are doing, we are also encouraging other ambassadors in the annual conferences to host meetings to empower, or rather to share with the others on that. And Susan has something to say about it.
I just want to add one story, and this is just to be thinking about this as Pauline talks about inviting people. I think that many of the issues we've discussed so far today are not conversations that we often have with people in conversations, and I think that's one of the things we have to begin doing as part of the building the movement. I was recently in an annual conference, an ambassador who brought a friend with him and began telling me how her pregnancy had been, that when she delivered her child, how difficult it had been, and that there were lots of issues related to the pregnancy and the delivery, that she was very grateful for the health care that she had access to. Out of that sharing of story, I then asked her if she had ever considered sharing that story with her member of Congress as a means to help the member of Congress understand why that health care access is so important, and we as people of faith need to ensure that everyone around the world has access to that kind of care. And she hadn't thought about that before. So I think as you consider engaging these conversations, to invite people to not just tell their story, share their story, but invite them to use their story as a way of educating people who haven't had that experience.
Thanks, Susan. The next thing we would love to engage you on is the Reach Out. Some of you, we're already working on this together. We have a sign-on letter, and we have postcards that we are sending to members of Congress encouraging them to sign on the REACH Act bill. It's going to be brought to the floor this month. So it's a big deal. If you haven't signed the letter, which is also on our website, and Tricia will send the link, please do and share it with as many people as you can in your congregation so that they can send it also. We had over, I think, 30 bishops who have signed on to a letter about the REACH Act, and we have actually sent it out to the members of Congress and the Senate. And we are now following up with meetings. Our General Secretary met with Senator Sessions and Senator Tillis, and we're going to be doing more meetings with the different members. And because of this initiative, we had one of the most conservative senators, Senator Sessions, sign to the REACH Act. So we're hoping that his signing on will also encourage other members to sign on. So please know that your letters are very important. Send it in and encourage others to send it in. Also, we're going to be doing more in district level advocacy, because these members, what moves them is their constituencies. If they don't hear from us in the constituencies, they will think that this is not important. So we will help you set up the meetings at the district level to go and talk to the staff and to the members themselves, and also just to, you can either focus on the REACH Act, or you can focus on making sure that they know the importance of empowering women and girls around the world. So please don't hesitate to call me or email me if you need help with setting up a meeting with a member of Congress or with a senator in your region. And also we help prepare people for the meeting. So once you have set up the meeting, then we'll get on the phone or a webinar or a conference call or email, and we will help you prepare talking points that you can use during the meeting. So please just let us know. And know that the last point is we will collaborate with other organizations on national meetings, advocacy, days, events. But it doesn't have to, it's already started this year. So I did say next year there, but this slide says we will collaborate with other organizations. Already we have started doing that. This month we are collaborating with Christian Connection for International Days for their conference, and also for their Advocacy Day on Capitol Hill. So we're really hoping that you will be able to keep eyes out. We're going to be sending you the invitations to these different meetings. And if you can, please let me know, and we'll help you with the registration and your participation. And since we are here in D.C., we hope that we can coordinate with you so that we are actually meeting with you also while you're here. I know we are telling you so many things, but I do believe that this summer and in the coming months, we have a lot to do, but I do believe that we can do all things through Christ who strengthens us, and that, this is our time, and that we can trust in God to help us build a movement to make a difference around the world. Thank you.
Thanks so much, everyone. Susan, Mollie, Pauline, I didn't know if there was anything else that you wanted to lift up before we open it up for questions. But if you have any questions, you can definitely to me or to everyone in the chat box, or you can unmute yourself by hitting that red microphone icon and ask for the phone or through the computer. So if anyone has a question, please, and Mollie, Susan, and Pauline, jump in if there's anything you'd like to say.
I forgot to mention that the trainings for ambassadors, we know that most of our ambassadors are also UMW members, and we're talking to Mollie about doing joint trainings in the coming future, and we'll let you know when that will be and where they're going to be, and we're very excited about doing that.
Thank you, Pauline.
Thank you.
Does anyone have any questions for any of our speakers?
One thing I will say is that if any of you are close to know of or see people who are delegates to General Conference, to please give their thanks because they really did a spectacular job advocating for women and girls.
Still muted.
So we had a question about resources, and so I just want to remind everyone that we'll be sending around an email after this that will have resources that Mollie has lifted up and resources that Pauline and Susan have lifted up from UNW and GBCS, including where you can take action to urge your members of Congress to support the REACH Act. Enter on the link for the Growing Up Girl video, but that also will be included in an email that we send around. So keep an eye out for that. And if there's anything that you'll have a question about, or you think you'd like a resource on, and you can't find it easily, you can email any of us, and we'll be sure to get you connected to it.
While you're thinking about questions, I just wanted to give a shout out to United Methodist Church because it is still one of the most progressive churches when it comes to women's empowerment and girls' rights, and especially on the issue of family planning. A lot of our sisters are struggling around the world and in denominations that continue to let them die of lack of access to family planning. I do believe that we can do better, but let's rejoice in achievements that we've made and continue to seek on how to share them with others so that others know that this exists. One of my favorite experiences at the General Conference was just knowing that we didn't lose the social principle on family planning, because that would have been devastating, but we didn't. That was saved, and because of that, we can still say to women, United Methodist women around the world and others, that you do have this protection from the social principles. So let's continue to work to ensure that stays the same.
I want to echo what both Pauline and Susan said. First, our thanks to the many delegates who did advocate for women and children. Just because the whole conference didn't move on some of these resolutions, a lot of that was largely due to time and parliamentary constraints. And so we had a great many people who worked really hard to get everything to the floor, and some of it just didn't happen. But even in the debate on RCRC and responsible parenthood, so I had the opportunity to give really good, solid information about what goes on around the world and what women and girls face. So we were fortunate to have some really great delegates, well-spoken and well-versed in family planning from around the world, speak to these issues. And so at least people heard the message. And of course, there's still plenty of ground, both in the discipline and the Book of Resolutions, for us to continue to work on behalf of women and girls around the world.
One of the things that I want to make sure that folks know, there have been a lot of people concerned about the Methodist Church's General Conference decision for Methodist women and church and society to not be members of RCRC. I know that there are a lot of people that are connected with RCRC at annual conference level, at state level, and those connections will continue to be available because the advocacy needs to happen. And I think in a lot of places, advocacy is happening in interfaith coalitions as well, and is something that vision, I think, so I was asked to speak to RCRC on the floor of General Conference, and one of the things I said is that the history of RCRC is so important, of local clergy being concerned about women who were getting safe abortions because they needed to end a pregnancy and it was not yet legal. And so we know that there's a tremendous, there's a lot of silence around this that continues, and the resources that RCRC provides are really important. And so know that is something that will continue to be a resource, even if not through Church Society and United Methodist Women will still be doing this work. We will not be partnering with RCRC in that.
So are there any other questions? That's all. I think I covered all of the questions that people had sent me in the chat. But if you'd like to unmute yourself and ask a question over the phone or send off a question through the chat box, that would also work.
Very much.
Well, I don't see anyone asking questions, so I just want to remind you all that that you can definitely reach out. I'll be sending an email recapping all of this information, and I'll be sure to include contact information. So if you have follow-up questions or if you'd like further information about different resources, please feel free to reach out to any of our presenters. And so with that, I will just let Susan, Mollie, or Pauline say the last word, and then we will close it out.
Participating and for your commitment to women and girls in reproductive health care. The United Methodist Church will continue to advocate and will continue to demand that rights and care are accessible and legal so that women and girls can thrive the way God intends all of us to.
For me, looking forward to hear from you. Any way we can support you in the work that you're doing, please do not hesitate. But the other thing is we want to hear from you about how we can make our programs better. So if you have any ideas as to how to make our programs better, we are also listening. So please send us an email or a phone call. And we do wish you a wonderful summer. Enjoy it, and let's continue to work together. Thank you.
I would just echo what both Pauline and Susan said. We so appreciate this partnership, but also the partnership with all of you as we continue to organize for women and girls and to make sure their voices are heard and their rights are cared for.
Well, all right, so we will go ahead and follow up with an email, and thanks everyone so much for hopping on. Have a wonderful rest of your day.
Thank you.